So, I'm going to be doing a ear inspection today. I'm going to be thoroughly examining the ear, applying some cleaning techniques, and if I see fit, therapy such as skin pulling or cupping. Okay, so you've been having some mild ear pain.
Yes.
Could you tell me a little bit more about that?
It goes towards the back of my ear, and I feel like there's something inside.
Okay.
But I can't get it out.
Okay. Alright, I'm going to take a look inside. Can I remove this earring?
Yes.
Okay. Okay. So I just want to visualize the tympanic membrane. It's a pearl gray, which is a good sign. We just need to rule out signs of an infection. I'm seeing a lot of debris, wax, and some clear discharge. So I don't see any pus, but it is clear and it has a viscosity to it that has me a little bit concerned. So I'm going to be doing an in-depth cleaning and looking again so I can better visualize what's going on. Okay. Okay, so first I'm just going to be palpating. Okay. I'm not feeling any contusions. Your lymph nodes are non-palpable, which is a good sign. So I don't think that this is a sinus infection. Do you have any pain here?
No.
Okay, so when I pull the ear up, do you have any pain?
No.
Okay, and down?
No.
Okay, and back?
No.
What about when I push forward?
No.
Okay. I'm going to be taking a sample of the outer ear just as it is now before I clean it. Okay. And we're going to start with an antiseptic spray. This is just to sanitize the skin. Okay. go ahead and just take your hair and move it a bit to the side. There we go. Okay. Okay. This is going to help soften the skin because some of the cleanser is really harsh on the skin follicles, so we just want to prevent any kind of reaction. Okay. Okay, it's going to get a little cool. trying to visualize the internal structure in the area of the nape leading to the main ear canal. I'm seeing the corporal nerve is pronounced, which is not what we like to see, which just means that there is some inflammation going on. Okay. And so cleaning it does allow me to better see that this is an issue. I'm going to look behind here to see if there's any strain on the veins. They look purple, thin, which is normal. Normal outer aural nerves. Okay, just let me know if you feel any sharp pains. I'm going to be just tapping on certain parts. Okay. So the outer ear looks healthy with the nerve inside here. The corporal nerve is shutting out a little bit more than I'd like to see, and I'm interested to see if that is symmetric on both sides, if that's this a characteristic to your ears, or if it is a problem. So now that I have it cleaned, I'm going to take a closer look. Okay, we still have a little bit of wax. Okay. I'm just going to do some cleaning with a dry implement. Just getting out some of the excess wax. Okay. Okay, now that I'm seeing a little bit better here, I see some purpling, which I believe is just that blood circulation is compromised. I'm going to be using a tuning fork and just doing a couple hearing tests, okay? So I want you to answer which sound is farther away, A or B. This is A. This is B. B. Okay? Here's A. Here's B. A. Okay? Here's A. Here's B. Here's A. Here's B. Okay. Here's A. Here's B. Okay. Here's A. Here's B. A. Okay. Here's A. Here's B. A. Here's A. Here's B. Okay. Here's A. Here's B. Good. Okay. I'm going to be placing it right underneath the ear. Go ahead and let me know when the sound stops for you. Okay. Okay. I'm going to be making a brushing sound right outside your ear. I want you to let me know when the sound stops. Just say no. Okay. And how many times do you hear the brushing sound? 1, 2, or 3?
1, 3.
Okay.
2, 1, 3.
Okay. I'm going to be whispering some colors in your ear. Repeat the color you hear after me, okay? Orange,
Orange,
purple,
purple,
green,
green,
brown,
brown,
blue,
blue,
black.
black.
Okay. So, I don't believe your hearing is compromised, but I do think that there are some trapped vesicles around the perimeter of the ear, and it's pointing to a loss of circulation. So I'm going to try to detoxify the area around the ear by just doing some pressure point therapy and also some massage work, okay, with some tools just to get the blood flow going, and then I'll go ahead and look at that vein again. Okay. Do you have any known allergies to topical ointments? Okay. There's a bit of swelling right outside the ear. No nodules or lumps that would indicate lymph node enhancement, but just some general swelling means that we just really need to work on getting the blood flow going. And sometimes hearing loud noise like fireworks or loud music at a concert can cause trauma to the ear and cause the veins to work extra hard. And the corporal vein has become enlarged. And it just needs to be worked on. So that's what we're doing here. Going to be tugging slightly on the ear. To encourage blood flow and getting rid of toxins that might be causing blockage. Okay, Magpie, so next I'm going to be applying some pressure point therapy to the outer edge of the ear and also along the lobe. If it gets to feel too intense, please let me know. But this should really aid the process. And here I'm just wiping away some of the excess ointment. Okay. Okay, next I'll be adding some cupping therapy. just getting a hold of some of the trapped blood and moving it outwards to regenerate the circulation of the face. And I'm going in a circular motion. Very good. Okay. Okay, before switching to the other ear, I'd like to do a sharp or dull test, okay? So this is a sharp sensation, this is dull. Go ahead and say which one you feel. I'm just trying to test your neurological responses along the ear to make sure that there's nothing compromised, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, just a few incorrect responses there. I'm going to just have you flip around and I'm going to take a look at the other ear. Okay, I'm going to start just by putting your hair up to get it out of the way. Okay, that's perfect. Oops. I'm going to take out your earring. Okay. Looking inside, I'm seeing a little bit less inflammation here, but I need to clean it. I do see a couple of whiteheads and wax buildup. Not as much purple, but I need to clean to make sure your tympanic membrane looks to be about the same color, which is a good sign. Okay. Okay. And taking a sample of the inner follicles. Okay. Okay, so with this being cleaned, I'm going to just tug on your ear. Let me know if you feel pain. Okay, and down, no, and up, and pulling inward. Any pain here? Okay. Okay. Post-auriculars are non-palpable. Sorry, pre-auriculars. Just a little bit of swelling along the midsection, and that's parallel to the corporal nerve. But I don't see as much swelling. I'm going to continue cleaning with the foaming cleanser. sinus areas, less inflammation. I'm not seeing as many purple spots. So there's definitely not infection, but it is, again, in need of just some work with circulating the blood flow. Okay. Okay, this nerve is not as inflamed. It barely is, so I think that the right ear is in a lot better shape, but I'm still going to do the same therapies. And just be sure to de-wax your ears on a regular basis. I'd say once every 2 weeks is a good time frame. And you might feel a little bit of soreness in both ears in the next couple days, but that's normal. There shouldn't be any shooting pain or muffled hearing. If you have any of that, definitely give me a call right away. But just general soreness means that the blood vessels are learning to reactivate. Okay. Alright, I'm going to do a hearing test. You're going to hear the tuning fork. Let me know which is further away, A or B. A or B.
B.
A or B.
A.
A. B.
B.
A. B.
A.
A. B. A. B. A. Okay. Now let me know when the sound stops.
Now.
Okay. Now let me know when the rustling stops, okay?
Now.
I'm going to whisper some holidays in your ear. Let me know the holiday that you hear. Christmas.
Christmas.
Easter.
Easter.
New Year's.
New Year's.
Hanukkah.
Hanukkah.
Valentine's Day.
Valentine's Day.
Halloween.
Halloween.
April Fool's Day.
April Fool's Day.
Okay, very good. And neurologically, you seem to be operating intact. I'm going to do a sharp or dull test next.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Dull.
So, neurologically, you seem to be intact. I'm going to have you lay down on the bed in a more comfortable position just so I can look at your scalp to make sure that there isn't any neurological. Okay. Tympanic membrane is gray and intact. Okay. I'm seeing a little bit of wax build up. Do you mind if I clean a little bit in your ear just to get that out of the way so I can better visualize what's going on? Okay. Do you have any hearing issues? Okay. Just going to tuck your hair back a little bit here. Okay. Okay, not too much wax in there, but I just wanted to make sure. Alright, I can better visualize the membrane. No scarring, scratching, or signs of infection. No signs of prior damage. Yeah, your ear looks perfect. Let me go ahead and look at the other one. Okay. Same thing here, just a little bit less wax, but it's still kind of obstructing the canal, so I like to just do some very light cleaning. I think that it's going to help you hear better as well. Okay. 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 Okay, gonna go ahead and take another look. Alright, same thing here. Your ear canal's very healthy. No scarring. It's pearl gray. No purpling of the skin. Your circulation looks very good. So I think we'll move on to just some basic hearing tests and then we'll move on. Okay. I'm going to take this tuning fork and just making vibrational sounds just underneath the ear and different places of the sections around the ear. Okay. Let me know when the sound and vibration stops, and if you don't hear it at all, let me know that as well. Okay. It stopped. Stop. 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 Okay. Stop. Okay. And using a different tuning fork, let me know which sound is louder, A or B. Keep your eyes closed. This is A. This is B. A. Sorry, that was a little loud.
Yeah.
A or B?
Which one was A? Which one was B?
A. B?
B.
Okay. A or B?
A.
Okay. Let me know if the sound is coming from beneath your head or above it.
Okay. Below.
Okay.
Above. Below.
Okay.
Above.
Okay. Very good. Next, I'm going to make some rustling sounds. Let me know if you hear it on your right or your left ear, okay? Left, okay.
Right. Left. Right. Left. Right. Very good.
Okay. Your tympanic membrane is pearl gray. No excess wax. No signs of infection or scarring. Very good. No issues here. I'm going to look at the other ear. Very healthy ear canal. Normal visualization of the tympanic membrane. I would clean your ears today, but you've done such a good job yourself of cleaning them. I don't see many issues here. Let me look at the outer auricle. No irritation. Very healthy. We're just going to do a few basic hearing tests. So close your eyes. You're going to feel my gloves rustling on either your right or your left ear. Say left or right depending on which one you feel.
Left, right, both, left, right, right.
Very good. Okay. I'm going to do a couple exercises with tuning forks. Yeah, that's right. I'm going to give you two options, option A and option B. Let me know which sound is closer. Go ahead and close your eyes. A, B, B, good. A, B, B, good. A or B, B, good. Okay. This is a vibrational tuning fork. I'm going to be placing it in different areas of your face, and then I'll be stopping it. Let me know when the vibration stops for you, okay? Okay. Okay. Very good. Okay. Just one more hearing test. Go ahead and close your eyes. I'm going to be whispering some things in your ear. Repeat exactly what you hear after me. Thanksgiving. Thanksgiving. Christmas. Christmas. Halloween. Halloween. Valentine's. Valentine's. Puppies. Puppies. Plant. Plant. Seashell. Seashell. Tissue. Tissue. All right, very good. So I'm pretty pleased with that. I'm going to have you lay down on the bed so I can look at your scalp a little bit more, okay? Move on to just a general hearing test for you. So I'm going to be taking my gloves and making a rustling sensation. Let me know if you feel it on your left or your right ear, okay?
Left.
Okay. Keep your eyes closed. I'm going to just be whispering a few different words and just repeat exactly what you hear after me. Pencil.
Pencil.
Paper.
Paper.
Light bulb.
Light bulb.
Farm.
Farm.
Okay. Good distinction of pronunciations. I'm going to use a few different tuning forks. Okay, this first one, I'm going to give you two options. Option A or option B. I want you to tell me which sound is louder to you. Okay, so which one seems closer? A, B.
A.
Okay. Definitely not the case. All right. B.
B.
Okay. All right. A. B.
A.
Okay. So those should have been about the same. Next, I'm going to just use a different tuning fork. I'm going to be gently placing it on the sides of your face and also on the top of your head. You should feel a vibrating sensation. Let me know when that sensation stops for you, okay?
Stopped.
Good.
Stopped. Stopped.
A little delayed there. Okay. One more.
Stopped.
Good. Okay, so for the most part, you're hearing I want you to take a few deep breaths while I do some relaxing beat therapy. You should feel the tingles running down your neck with the sound of these beads, just arranging, providing clarification. do some tapping with the shell. Just continue to relax. I'm pretty happy with your vision and your eyes look beautiful, so I'm going to move on and just look in your ears now. Okay. Do you have any hearing issues?
Sometimes I do hear a loud sound at night.
Okay.
Kind of wakes me up, but I don't know if it's because I'm dreaming or because my ears are actually making that sound.
Yeah.
But I do kind of wake up. I'm scared from
Does
that.
it sound internal, or is there someone in the house?
It sounds internal.
Okay. All right. That is very interesting. I'm going to look into that for sure.
Okay, thank you.
Okay. Go ahead and look straight ahead. Okay. Your ears are completely wax-free, which is good. I'm able to visualize the tympanic membrane. It's a little bit wider than what I'd like to see. We like to see a pearl gray, and this is kind of a beige to me, which could indicate some damage to the tympanic membrane. I don't see any signs of infection, so there's no inflammation present, just a little bit different in color. I'm going to check the other side. Okay. This one looks to be completely healthy. It's a pearl gray. Same thing here, same amount of wax, very little. No scarring or scratching, no signs of infection. Okay. I have some eardrops I'm going to send you home with that I think is going to help that left ear, and we'll see if that improves it. For now, don't let me forget that before you leave. I'm going to do some hearing tests though. So you could close your eyes. Let me know which ear you hear the rustling in, your left or your right.
Right.
Okay.
Left. Left. Right. Both of them.
Okay. And let me know when this sound stops. You're going to hear kind of a buzzing sound. Say now when it stops.
Now. 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 Now.
You're going to hear a rustling sensation again. Let me know if you hear it once, twice, or 3 times.
2. 1. 3.
Good. And which sounds further away? Option A or option B? This is B.
A B is further.
Good. This is A. This is B.
A is further.
Very good. Okay. So I'm pretty happy with what we've done with your cranial nerve assessment, except for your ear, which I'm going to take note of for sure. All right, so I'm going to have you go ahead and put on a gown just so I can assess the rest of your body, okay? You're going to be laying down face up. Okay, very good. Very healthy tympanic membrane. No excess wax. It's a nice pearl gray. No signs of infection or irritation. Go ahead and turn towards me. Very good. And same here. A little wax on the right side, but not enough to impede ear function. Just clean that out in the next couple weeks and you'll be good. Nice pearl gray. No signs of stress to the membrane. Very good. Do you hear my gloves on your left or your right side?
Left, right, both.
Very good. Alright, you're going to feel a vibrational sensation and hear it throughout your skull and your resonance chambers. Let me know when the sound stops, okay? Just say now.
Now.
Good.
Now. Now. Now.
Great. Okay, we're going to do it again, just with a different tuning fork, and I'll also be placing it on your collarbone.
Now.
Good.
Now. Now. Now.
Excellent. Okay. And with our last tuning fork, you're going to tell me which option sounds louder to you, closer to you. Option A or option B, okay?
Okay.
This is A. Here's B.
B.
Good. Here's A. Here's B.
A.
Okay. Here's A. Here's B.
B.
And did you hear that on your left side or your right side?
My left.
Very good. What about now? Left or right?
Right.
Good. Okay. So your hearing is great. Before I move on to your scalp, I'm just going to quickly check your eyes. Okay, your tympanic membrane is really hard to visualize because you have a lot of wax buildup.
Mm-hmm.
I don't think you have any signs of infection or improper ear health, but with your permission, I would like to do some cleaning today just so I can better see it.
Mm-hmm.
Okay, I'll look at the other side. Okay, same here. Although there's not as much wax, it's still very present. I can see the membrane a little bit better here, and it looks to be pretty healthy, but I just like to be sure.
Mm-hmm.
So what I'm going to have you do is just lay down on the bed, face up, and I'll clean your ears.
Awesome. Thank you.
I'm going to start with just the alcoholic pad to sanitize the area. Oh, sorry. That's okay. Now just to test your ear sensitivity, I'm going to tug once, twice, or 3 times. Say 1, 2, or 3, okay?
Okay. 1, 2, 3.
Good.
2, 1, 1.
Good. Going to use antiseptic spray. You're just going to feel some cool and tingling sensation. Okay, and using a third swab, I'm going to just collect the sample. Just because I saw a little bit of redness that I think is just from the cold weather, but I want to make sure. Set that aside. Now, for the wax, I'm going to use a foaming cleanser. So just turn your head a little bit this way, right there. It's perfect, just so I can see a little bit better. to scrape out the excess wax very gently. Okay. Let me see if I can better visualize. So go ahead and just tilt your ear very slightly. Good. Much more clean. I'm seeing a pearl gray membrane. Very healthy. No issues there. Okay, so I'm not worried about that. Okay, I'm just going to apply a little bit of oil and do some very gentle cupping beneath the area. Just move a little bit here. Okay. Okay, before I move on to the other ear, I'm going to do a little bit of pressure point therapy and then we'll do a pressure point test. Alright, let me know if this is too painful or too much pressure. Just to give you a reference, this is 1, this is 2.
Okay.
Okay.
1, 2, 1, 2, 2, 2, 2, 2, 1, 2, 2, 2, 1, 1, 2, 2, 2, 1, 1.
Okay. Let's start with sterilization pad. And as I tug on your ear, say it once, twice, or 3 times.
Okay. 1, 2, 3, 1, 1, 1, 2, 2.
Just apply some antibiotic ointment to prevent infection. Okay. Followed by sample collection. Still a specimen right here. And in beneath these folds. Beautiful. I'm going to give them some solution to live in. Next, I'm going to find a cleaning solution. Okay, just going to get the excess debris out here. And we'll do 1 or 2 pressure points.
1, 2, 1, 2, 2, 1, 2, 2, 2, 1, 1, 1, 1, 1, 1, 2, 2, 2, 1, 2, 2, 1, 1, 2, 2, 1, 1, 1.
Okay, Tori, so that concludes the exam.
Mm-hmm.
I'm going to do an order for a CT scan just to investigate more the loss of taste.
Okay.
Since it has been only 3 weeks, it could just be a hormonal change that your body's going through.
Okay.
But we do want to make sure that there's nothing serious. Your ears are very healthy, and that's what I have to say.
Awesome. Thank you so much.
Okay, thank you for allowing me to do this exam, and we'll see you here next time, okay?
Awesome. Thank you.
All right. Just with your eyeballs. Don't follow my fingers, follow the light. Nice, okay. So your eyes seem very healthy. Any issues seeing? No. Okay. I'm going to test your hearing now. So go ahead and close your eyes. Let me know which ear you hear the rustling sound in, your left or your right ear.
Left, right, right, both.
Good. Now let me know if the sound of these gloves are coming closer or further away from you. Okay, so here's option 1.
Closer.
2.
Farther.
Okay.
Farther. Closer.
Very good. I'm going to whisper a few words in your ear. Repeat what you hear after me. Left.
Left.
Right.
Right.
Center.
Center.
Christmas.
Christmas.
Cabinet.
Cabinet.
Volleyball.
Volleyball.
Very good. So I have this tuning fork. I'm going to be placing it on different areas of the face.
Okay.
Close your eyes. You're going to feel and hear the sensation.
Okay.
Let me know when it stops, and if it stops at different times, let me know that too.
Okay. Stopped. Stopped. Stopped.
Let me know which option is louder.
Okay.
1 or 2. This is 1. This is 2.
2.
Good. This is 1. This is 2.
2.
Good. This is 1. This is 2.
1.
Very good. Any issues with your hearing that you've noticed?
No.
Okay. Just to encourage the release. Of drainage. Gently just seating the ear, especially in the upper edges, to release pressure and tension. Let me know if it gets to be too much. I'm going to just go with a softer side. Okay, just using a little bit of water here. Encouraging that to drain. Applying more pressure in the ear. Okay. Your tympanic membrane is pearl gray. You have a little bit of wax buildup, but not too much to obstruct my vision of the membrane, so very good. No issues here. Any problems with hearing? No? Okay. No.
I wear earplugs to go to concerts.
Oh, you do. That's very responsible of you.
Thank you.
I'm very glad to hear that. Yeah. Go ahead and look straight. It's a cute earring that you have.
Thank you.
Okay. Nice and pearl gray. No scratching or scarring. No signs of infection. Okay. I'm going to do a couple of tests with the tuning fork.
Yes.
Okay. So I want you to let me know which sound is louder, A or B. And I'll just use this. Okay. This is A. This is B.
Okay.
Okay. So go ahead and close your eyes and let me know which one is louder to you. A.
A.
B. A. Okay. A or B.
A.
Okay, good. I'm going to be placing the tuning fork directly under your ear. Let me know if you hear and feel a vibration or a pressure.
Pressure. Vibration.
Good.
Vibration. Pressure.
Good. And I'll be doing it to different areas of the skull as well.
Pressure. Vibration. Pressure. Vibration.
Good. I'm going to be making a rustling sound, and let me know if you hear it on your left or your right side.
Left. Right. Left. Left. Right.
Okay. And do you hear it from above or below your head?
Below. below, left.
Okay, good. Okay, so I'm looking inside. Okay, I see your tympanic membrane. It is definitely looks very irritated. Usually it's a pearl gray, but yours is purple and red, and I see that it is swollen. So definitely injury there. I don't see scarring and scratching. And a sign that the membrane might be dying is if it has black around the edges. And I don't see that. I just see it's very, very irritated. I see a lot of wax buildup here too, which might definitely be irritating the membrane compoundingly. So this gives me a lot of information. Go ahead and turn your head this way so I can look in the other ear. Okay. Seeing here that the membrane's actually healthy on your left side. Very, very light redness. So maybe you were biased speakers and your head was positioned in a way where your right ear was closer to the source of the music, or maybe just more sensitivity there. Okay. So that tells me a lot. Okay. I'm just going to look at the skin around the area of your outer auricle. Okay. Definitely seeing a little bit of dryness, dehydration, and then some slight flaking. And when you have flaking in that outer auricle, it can definitely flake off and get into the ear canal, which can cause further irritation. So I'm definitely going to be cleaning the whole area, sterilizing and removing some of the wax today. Okay. Alright, let me go ahead and look at the other side. Not as much here. Okay. So what I'd like to do is just do a few movement tests. I'm going to tug gently on your ear. I'm going to tug upwards. Let me know if you feel the sensation once, twice, or 3 times.
Once. Once.
Okay. And downward.
Twice.
Let's do it one more time.
Once. Twice. 3 times. Once.
Good.
Twice.
Okay. Did you feel any pain?
No.
Okay, so both sensations were equal in both ears?
That's right.
Okay. So I have a tuning fork. I'm going to be making a vibrational sound. You should hear it and also kind of feel it outside of both ears. I want you to let me know when it stops, okay?
Okay. Stop. 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 Stop.
Okay, gonna be doing the same thing, just at a different frequency. Okay? Let me know which sound sounds louder to you, A or B. This is A. This is B.
A.
Okay? This is A. This is B.
B.
Okay? This is A. This is
B.
B. Okay, very good. Okay. And once more, let me know when the vibrational sensation stops.
Stop. 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 Stop.
Good. Okay, so I'm pretty pleased with that. Okay. I'm going to be making a crinkling sensation with my gloves. Let me know if you hear it in the left ear or the right ear.
Right ear. Left ear. Both ears. Right ear. Left ear. Right ear. Both ears.
Okay. I'm going to be whispering some things in each ear. Repeat exactly what you hear after me, okay?
Okay.
Christmas,
Christmas.
Halloween,
Halloween. Okay.
winter,
Winter.
summer,
Summer.
lawn chairs,
Lawn chairs.
engines.
Engines.
Good. Okay. And just a couple more sensory tests. I'm going to be applying a pressure point to your ear. You know how many times you feel that point, okay?
Okay. Twice. Once. 3 times. Once. Twice. 3 times. Once. Twice. Once. Twice. Twice. Once. 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 Twice.
Okay. Normal so far. Okay. Okay, so next we're going to do a sharp or dull test. We're going to do a reference point on your forehead. So does this feel like a dull sensation?
Yes.
Okay, and does this feel sharp?
Yes.
Okay, I'm going to be going around the ear area. Say sharp or dull. I'm just going to tilt your ear this way.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay, go ahead and turn your head this way. Very good. As much as you can, remember to be comfortable.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Back to center. Very good. Just a few more here on the problem ear.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay.
Sharp.
Very good. I'm not too worried about that. Okay. Okay. And you're going to be feeling one or two pressure points. So say one or two, okay?
Okay.
So say this would be one, this would be two. I'm going to be, of course, focusing on your ear.
Okay.
Okay?
1, 1, 2, 2, 1, 2, 1, 2, 2, 2, 2, 1, 1, 2.
Okay. A lot of inaccuracies there. Okay, let's keep going. Gonna do some on the face just for reference point.
2, 2, 1, 1, 1, 1, 1, 2,
Good.
2, 1, 1, 2.
And turn your head very gently.
2, 1, 2, 1, 2, 1, 1, 1, 2, 2.
Okay. Very good. I'm going to take a sample for our lab just to make sure there are no harmful cultures in your ear. It's important to know whether we need to apply antibiotics. Okay. Just getting some samples of the skin and the skin flakes. Okay. Excellent. We have just a saline solution that it will rest in. Okay. Forgot to put it in. Okay, there we go. So we're going to send that to the lab for testing. Now, I'm going to use an alcohol pad just to sterilize the outer ear, okay? Okay. So it's going to smell pretty strong, but just to ensure that it's sanitary. Okay. It might be a little red for a while, but it's not uncommon. Just gonna clip back this section here. Okay. Okay, perfect. I'm going to apply a little bit of serum to the outer ear, just to further cleanse. Okay, just tilt your ear this way. Perfect. Okay. Very good. So just going to further inspect with the light. Okay, I'm seeing that flaking, and I'm going to be just gently scraping some of that off for you. Getting some of that debris out. Okay. Do you mind if I remove your earring?
Go ahead.
Okay. Okay. So next, I do have a foaming cleanser that I'm going to apply. Okay. And it's going to be along all the outer areas of the ear, and I'll be gently working in. So just relax. This is really going to soothe the visible irritation of the membrane in response to the loud music that you heard. Your ear responded in a way that was very physically apparent to me with redness. So this is vanilla-based, very powerful antiseptic. They're just going to cleanse the area. Okay, you might be a little red. Might be red in the area for a couple days, but that's normal unless you have an allergic reaction, which I've never experienced before with a patient, so you should be good. Okay.
I feel a lot of relief. It feels really
Good. It should just feel cool and soothing. Okay. Just brushing the area back here. So I'm going to be going more in the inner ear. Okay. Just scraping out areas that probably have a lot of debris from being hard to clean in the first place. Okay. Perfect. Really going to get the area behind the ear as well. Okay. Okay. And I'm going to take another tool, this honeycomb shaped tiny little ear cleaning tool, to just does not look irritated at all. So, it doesn't look like your ears are sensitive in general, just sensitive to that level of noise. Okay. I'm going to apply some pressure point therapy to the outer auricle. Let me know if it feels painful and I'll stop. But this is what we call active repetitive ear seeding. There is sustained ear seeding, which would include actually placing sticker-like objects on your ear. I find that this method is more effective. Okay. Just going a little bit deeper in the ear. And behind. Okay. While we let that ear rest, go ahead and turn your head. Okay. I'm gonna go ahead and get the other side very gently because this ear is in much healthier shape. Bring your ear back. Let's see. I'm seeing a little bit of redness, but it's pretty uniform, which means that the skin and the membranes in the ear are achieving a level of oxygenation from the pressure point therapy, which is just going to help the healing process. Circulation is always something we want to focus on so the body can heal itself. Okay. Go ahead and measure just the ear, just for comparison. Or so if the ears are different sizes, it might present some problems. I see that your earlobe is connected. It's attached. Okay. Your left ear is a little bit longer. Okay. just by a hair, but I'm going to make note of that in your chart. Okay. Okay. So next I'm going to apply some cupping therapy just to further oxygenate the area around the ear and apply pressure relief because there's a lot of pressure built up in your membrane and I want to disperse that from the outside. Okay?
Okay.
So I'm going to apply just a little bit of serum here. Okay, and you're going to feel a slight suctioning sensation.
Wow.
Yeah. Alright, the sound is a little startling, but this is super effective. Do you feel any pain at all?
No, no pain.
Okay, good. I'm just massaging the area. Okay. Okay. Re-cleanse the area. Okay. Nice and clean. And just doing some very slight pulling to massage the membrane and gently allow blood circulation to normalize again. Alright, I'm gonna go ahead and sterilize your earring before applying it back onto your ear. Okay. Are you feeling a little bit better, Ezra?
Definitely better than before.
It's going to take a while for this to heal. I'm going to send you home with some ear drops, and I'm going to prescribe some antibiotics for you to take too, just in case. And I'd like to see you again next week just for some more of this type of therapy if you're interested.
Okay, thank you so much. I really appreciate that, doctor.
All right. Thank you so much for coming in. Go ahead, get up on your own time, and thanks for allowing me to do this exam. Right inside the ear canal, looking for that tympanic membrane. You literally have no wax. Like none.
I just used my Q-tip today.
That's amazing. Whatever you're doing, I would encourage you to keep it up. Just be gentle with the Q-tips. Usually that's not a conventional method. But your tympanic membrane looks beautiful, oyster gray. No scarring or scratching. Looks like a very healthy ear canal. Okay, I'm just going to look at the outer ends of the auricle, making sure there's no bacteria buildup in the folds. Okay. Very healthy pores. And look behind the ear as well. Lovely. Okay, I'm going to look inside this ear. You have very pretty earrings on today.
Thank you.
Literally looks identical to the other ear.
Nice.
No issues, no wax, not even a hair. Are you an alien? Looks really healthy to me. Okay, just gonna check the outside of the ear, the folds. No, very healthy. Checking the outer auricle and right beneath, behind the ear. Healthy, no bacteria or fungus. Great. Okay. So close your eyes. Let me know which ear you hear my rustling, left or right.
Left. Right. Both.
Okay. I'm going to whisper some things in your ear. Just repeat what you hear after me. Summertime.
Summertime.
Boat ride.
Boat ride.
Flowers.
Flowers.
Celsius.
Celsius.
Dodecahedron.
Dodecahedron.
Yes. All right. I'm going to go to the other ear. Sunshine.
Sunshine.
Clouds.
Clouds.
Shih Tzu.
Shih Tzu.
And sweet potato.
Sweet potato.
Good. Very good. Okay. Just going to do a couple more tests. Okay. This is a tuning fork, so I'm going to place it very gently on the side of your face. You're going to hear it and feel the vibration. Let me know when both of those stop for you. They should stop at the same time.
Gotcha.
If not, let me know that as well.
Stop.
Good.
Stop. Stop.
Okay.
Stop.
Placing on the chin.
Stop.
Okay. This is the same test, just a different frequency.
Stop.
Good.
Stop. Stop.
Very good. Okay. And please tell me which sound is louder, A or B. A, B,
A.
A, B,
B.
A, B.
A.
Good. All right, how are you doing on bladder? Do you feel the need to pee? Not yet, it's a little early, but we're gonna make sure that you pee. It's especially important after the kind of surgery that you had. Okay, so we need to go ahead and move your head this way. I'm gonna take a look inside your eyes here, or your ears, sorry, your ears. All right. Oh, tympanic membrane is a nice pearl gray. A little bit of redness to the side, but not enough to indicate an infection. And it looks like you really clean your ears. So it's very good for me to see that. All right, go ahead and look the other way so I can check the other ear here. Okay, very nice. Tympanic membrane looks beautiful here. Wax free. Okay, I'm really liking the color that I see. Do you have any history of hearing problems or ear issues? Okay. Do you remember the last time you had an ear infection? Okay, probably as a child. That's good. Alright, I'm just going to do some very simple hearing tests next. Okay, so first I'm going to do a hearing test with my words. I'm going to whisper some things. I want you to let me know exactly what you hear. Repeat after me. Close your eyes. No looking. Okay. Santa Claus. July. Hyacinth. Rosemary. Jeff Vandermeer. Jack Kerouac. Albert Camus. Cormac McCarthy. Virginia Woolf. Shirley Jackson. Very good. I think just a couple more. Okay, so just close your eyes. Emily Bronte. Jack Shimmick. Dave Eggers. Excellent. So those are really good. Okay. Let me know which ear you hear the rustling on, your left or your right. Good, okay. Going to be using a tuning forks for this next section. So continue to relax. Just going to make sure that you are hearing properly. Okay. So I want you to tell me which sound is louder, A or B. Close your eyes. Here's A. Here's B. A. Good. Here's A. Here's B. Good. Here's A. Here's B. A or B. Good. All right. Next, I'm going to be placing this tuning fork directly on your head. You're going to feel the vibration and also you're going to hear it. Let me know when the vibration stops in terms of feeling it, okay? So if you keep hearing it, that's one thing, but I'm more interested in the vibrational feel, okay? Say no. Good. 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 Excellent. So you're hearing tympanic membrane is a nice pearl gray. I don't see any scarring, scratching, no excess wax. Well, you do have a little bit of wax, but it's not, doesn't look to be obstructing my view of the membrane. Okay, just gonna look here, just around the outer edges of the auricle. Just looking for any fungus, any signs of infection here. It looks very healthy. These are very cute earrings, by the way.
Thank you.
Okay. Then look at the other ear. Okay. There's like no wax on this side, so that's good. The membrane is pearl gray. Nothing obstructing my vision of it, and No scarring or scratching. I'm going to just go ahead and peek up here again. Any hearing problems?
No.
Okay. Ringing in the ears or hearing things that aren't there?
No.
Okay. Just gonna look behind here too. Very good. Okay. Go ahead and close your eyes. Let me know if you hear the rustling on your right or your left ear.
Left ear. Right ear. Both ears. Right ear. Left ear. Both.
Okay. I'm going to give you two sound options, option A or option B. Let me know which sound is closer to your ears, okay? A or B?
A.
Okay. A or B?
B.
Okay. A or B?
B.
Okay, very good. I'm going to bring this tuning fork to your head and just along different resonance chambers of the scalp. Let me know when the sound stops. You should feel a vibration as well, but mostly we're focusing on sound.
Stopped.
Good.
Stopped.
Good.
Stopped. Stopped.
Okay.
Stopped.
Good. To encourage drainage in the lymphatic system.